This video is brought to you by Prompt Valley Air Conditioning and Heating, 775-727-7488.
Our students are struggling with social emotional well-being.
Amy Quinn, who runs an inner-city public charter school in Washington, D.C., is seeing what the rest of the nation is when it comes to the mental health of her students. But fortunately for the children here at Yu Ying, the school has always placed an emphasis on their mental well-being.
Prioritizing that over anything else has benefited us throughout this whole time.
The Centers for Disease Control and Prevention reported that between April and October of 2020, the number of mental health-related emergency department visits increased for children and teens. Kids ages 5 through 11 increased by 24% and 31% among those 12 to 17, compared to the same time period in 2019, pre-pandemic.
Certainly, COVID has revealed not only has it created these tensions and so on, it's revealed underlying problems that have been there a long time, particularly in regard to our mental health system.
State officials are taking notice of the mental health issues that are facing young people. Several states like Illinois are implementing mental health days. A new law went into effect this month, allowing students between ages 7 through 17 to take up to 5 excused mental health days without a doctor's note. If a student requests a second mental health day, they may be referred to school staff for professional help.
I think the intention is very good, and their interest and their concern about mental health.
Mark Atkins, a professor of psychiatry and psychology at the University of Illinois at Chicago, believes that providing mental health days is just the beginning of a lot more work that needs to be done.
If we really want to do something about this other pandemic of health and mental health, let's think about the system that isn't responding to the needs of kids, particularly isn't responding early enough. Let's intervene early.
Atkins says that support doesn't always have to come from a mental health provider either. It can also come from a trusted adult at school.
I know as a mental health person that we can provide support to teachers so that they know what to do. Sometimes we call it mental health first aid. And I very much want the legislatures and all to hear that they're on the right track, but we've got to do more.
Kim Martinez reporting.